All right, good afternoon, everyone. Thank you for being here. Today, our group will be presenting in obesity in New York City, a serious health problem that continues to affect thousands of residents across all age groups. My name is Khadija Kebe, and I worked on the first section of our research, an overall of obesity rates in New York City and how they change over the years. You'll be hearing from my group members, Elijah, Jasmine, and Francesca. Okay. So tackling the obesity epidemics in New York City. What is obesity? Obesity is a chronic condition marked by excess body fat, typically defined by a body mass index of 30 or higher. It raises the risk of serious health problems like heart disease, diabetes, stroke, certain cancers, and mental health issues. Causes are complex, including poor diet, inactivity, genetics, and medical conditions and environment. Obesity rates in the US and New York. Over 40% of adults in the US are affected by obesity. Nearly 30% of adults in New York State have obesity. Health issues linked to obesity are among the top causes of preventable death nationwide. Obesity in the US and New York State. Approximately 24% of adults in New York City are classified as obese. Obesity rates vary by neighborhood, with higher rates in areas such as East Harlem, Brownsville, and East New York. Communities with lower income and limited access to healthy foods tend to have higher obesity rates. The Bronx consistently has the highest rates among New York City boroughs. And in New York City public school, obesity is more common among Black, Hispanic, and low-income students, especially in grade kindergarten to the eighth grade. Trends and disparities over time. Over the past several years, obesity rates have remained higher, but show some variation by region and population groups. Black and Hispanic adults in New York City experience higher obesity rates compared to white adults. Socioeconomic factors, food access, and neighborhood environments contribute to these disparities. Targeted public health interventions are essential to address these ongoing challenges.
Show
Uh,
how obesity is measured, understanding BMI. This image shows how obesity is measured using body mass index or BMI. Anyone with a BMI of 30 or higher is considered obese. This method helps identify individuals at risk for health issues like heart disease, diabetes, and so much more. The weight of inequality and obesity in New York City. Many New Yorkers have noticed that the obesity rates have increased over the years. This is particularly and this is particularly shown in New York City low-income urban neighborhoods. One of the major contributing factors is an increase in fast food restaurants and limited access to healthy foods. Many New Yorkers can't afford high-quality fruits and vegetables, and New York has between 18,000 and 28 food establishments. They have a full service restaurant, which makes up the majority, with over 12,000 sit down restaurants across the city. Income and cost of food. Most New, most New Yorkers they make under $50,000 a year. With rent being high and other issues going on, they typically shop at affordable supermarkets and buy affordable items such as frozen pizza, TV dinners, and other items. And they would typically buy that rather than fruits and vegetables, which cost 10 times more. And there was a study in 2013 at the Harvard School of Public Health, and they analyzed 27 studies, and they found that the average cost, it costs $1.50 per day to eat healthy. And then furthermore, Manhattan is considered the healthiest borough with Soho and Tribeca, which is rated at the top. And then you have the lowest, which is Uptown, which is rated the lowest, come in at 38 out of 44 neighborhoods. And then you have another contributing factor, which is the unemployment rate, which is currently at 4.80%, which affects the ability to buy affordable nutrient foods. Health disparity in New York are influenced by systematic racism. Many low-income New Yorkers live in food deserts with limited access to affordable foods, and single income experience higher food insecurity than dual income ones. Additionally, I would advise everyone to exercise and not overeat to help cure obesity.
Obesity in New York City, public health efforts and future directions. Obesity is a major public health issue in New York City, affecting many groups and leading to serious conditions like diabetes and heart disease. With about 24% of adults classified as obese, targeted interventions are needed. Combating this epidemic requires public health efforts, community programs, and policy reforms. Public health efforts. New York City has launched efforts to reduce obesity through public health campaigns promoting healthy eating and exercise. Programs like New York City Green Cards increase access to fresh produce in underserved areas, while schools support healthier meals and physical education to build lifelong habits. Possible solutions and community programs. Community-based programs are key to fighting obesity. Initiatives like Shape Up NYC offer free fitness classes and nutrition support, focusing on vulnerable populations. Partnership with nonprofit promotes active transportation, while culturally tailored health education boosts engagement and impact. Policy changes. Long-term solutions need policy changes. Taxes on sugary drinks and limits on junk food adds to kids can cut calorie intake. Supporting health food in public spaces and zoning for grocery stores and farmers markets improve access to nutritious options. These steps create healthier communities. Tackling obesity in New York City needs public health campaigns, community programs, and policy reforms. Efforts should reduce disparities, increase healthy food access, and promote physical activities across the city. Lastly, lasting progress relies on strong community and policy support.
So this is the health burden of obesity. Obesity is a serious public health issue that harms physical and mental health while straining the economy. Rising rates have led to more chronic diseases like type 2 diabetes, heart disease, and certain cancers. It also impacts emotional well-being and increases healthcare costs. However, with the right care, awareness, and resources, obesity is largely preventable and manageable. Type 2 diabetes is one of the most serious health risks linked to obesity. It occurs when the body can't use insulin properly, causing high blood sugar. People with obesity are about 10 times more likely to develop this condition. If untreated, it can lead to kidney failure, amputations, blindness, and high lifetime healthcare costs. Obesity's physical and mental health consequences. Obesity is strongly linked to heart diseases, the leading cause of death in the US. Extra weight increases the risk of high blood pressure, stroke, heart failure, arrhythmias, and sudden cardiac arrest. Obesity also affects mental health, raising the risk of depression, anxiety, and low self-esteem. Those with obesity face a 55% greater risk of depression, while those with depression are 58% more likely to become obese, creating a cycle of emotional and physical health challenges. Addressing obesity and moving forward. It raises the risk for apnea, asthma, liver disease, osteoarthritis, and at least 13 cancers. It's also tied to dementia, pregnancy complications, and everyday issues like joint pain and incontinence. Healthy eating, exercise, therapy, and medication can help manage obesity. However, Medicare doesn't fully cover these treatments. Reducing stigma and expanding coverage are key to better care. Understanding and addressing obesity in New York City, a public healthy approach. Obesity in New York City is more than just a health issue. It's a reflection of deep-rooted social, economic, and environmental inequalities. Throughout this presentation, we've explored how factors like income, food access, education, and neighborhood environments all contribute to the city's obesity crisis. Ensure all communities have access to affordable, nutritious foods, create safe spaces that promote active lifestyles, advocate for inclusive health policies that serve everyone, reduce stigma, and support mental well being alongside physical health. Fighting obesity starts with fairness, access, and education. If we work together as a city, we can make real change and help every New Yorker live a healthier life. These are all of the references.
All right, guys, thank you so much for watching
Thank
our.
you.
All right, have a good day, everyone.
Okay, so this was our presentation. I'm going to stop recording now.